People, let me just get the live stream up for a second. And that way I can see all the questions I'm going to answer today. There we go. All right. Okay. Hi, everybody. It's Dr. Gary Batman from Teletrim here with our weekdaily live stream and one tomorrow to make up for missing Tuesday. A little bit about me. I'm one of the co-founders of Teletrim. We're a bunch of doctors who are passionate about personalized care in the weight loss domain. And part of that stems from I've been a doctor for 18 years. Prior to that, I was into maths. I was graduate maths. But I've been a doctor for 18 years and working my way through various specialties and winding up in GP. One of the things I noticed was that healthcare has become rushed. You know, the government's made Medicare rebates, money to the patient to pay for their treatment, frozen, less. And so for doctors to sort of help meet their patients in the middle or not have to pay, like bulk billing or something, consults have had to become rushed, a bit shorter, so to make up for that loss. And I found out there that having these rush consults meant that patients often might have left consults a bit stuck as to where to go next, or still a little bit confused, or that they were unheard, what they really came for. Or they might have even not had time to get to what they really wanted to go to because they weren't quite sure themselves. I think rushing as well kind of makes it so that you don't get to explore everything that's contributing to a person's medical conditions or their symptoms. You know, some things are simple, but medicine is quite complex. Our knowledge is increased, patient knowledge is increased. They have questions, they have Google, we have Google, hopefully we have brains. So one of the things I found, in the hospital, in private, in public, in GP, was that one of the things that was missing was just that extra bit of personal care, that thing that just goes, let's see this through to the end together. Let's make sure you understand where your next step is going, where all of this fits together, and how do we try to solve it, And maybe one doctor doesn't have that answer, but at least they can make a plan to talk to other doctors, set you up with other doctors, get you the right medications to tailor your medicine for you. And I think that's a big thing that you see everywhere, you hear about everywhere. And I think one area that is particularly underserved with good personal care, good knowledge, is weight loss. And I think a lot of that stems from the fact that there's so much information out there. Influencers, somebody, the neighbor down the street, the guy in the corner, parent at school has their own opinions or things they've done, or I read this thing, or I read this thing. And all of that may not be quite true, or might be true for a small set of people. So I think one of the things I found myself repeating over and over to patients was kind of just helping them navigate the myths and the legends, the myths and the facts, and trying to help them weave their way. Because a lot of times what happens is they do wind up following one of these healthcare weight loss myths, and it doesn't work. Even though the person on the TV lost 200 kilos in 1 week, or on the YouTube and on the TikTok lost that 200 kilos in 1 week. My skin went back to that of a 20-year-old with a 9-pack. It gets them discouraged, and it sets back their weight loss because they go, why am I even trying? This easy hack for weight loss didn't work for me. And so I found that one of the things it's important for weight loss is, again, to establish weight is a chronic condition. It's something that we battle long term. Evolutionarily, we're primitive. We're there for, survival. We're excellent at survival. But we built a world where food has been industrialized and easily made, tastes delicious. So delicious. Ice cream. I mean, could you imagine a caveman with ice cream? Cheaper, easier. But then that comes with consequences. It's probably less nutritious, or nutrition in the wrong direction, or missing out on nutrients. And so these are things that you need a medical professional to help kind of wrap your head around and help guide you through the landmines of false information. Sorry, just my daughters. I guess one of the things that I notice with patients a lot of times, or one thing that I do is, and partly what's core to Teletrim is, every patient is unique. Your problem, that's not unique. We see a lot of stuff in medicine. If something in medicine is truly, truly unique, it's probably going to be named after you. Or you could call it the Batman disease if I find it. No. But what is unique is your biology, what works for you. And I think a lot of times what surprises patients, or what are patients surprised when I ask to review their full medical history? And I think they're surprised because I like to start with, what are we working with? And a lot of times I might have an incomplete map of what problems you have, what's going on. I mean, even last night at the hospital, talking to a patient, or even today during some consults, I was talking to a patient and I was like, hey, we're using these things to treat these problems. 1, 2, 3, 4. And they're like, oh, hey, didn't I tell you about, I'm going to have this dental extraction, I've got this sinus problem, I've got this, or, I had my gallbladder out actually 5 years ago. Did I not mention that? Oh, well, that makes a difference, because now we don't need to hunt down that path. We can hunt down that path. So I find that, with a rushed consult, people don't get to kind of delve into the detail that you need to treat complex stuff. And again, particularly weight loss, where you go, that small 5 to 10% reduction in weight gives you such good metabolic, biologic health return. Here's a good question. How does taking time with patients' history actually change medical decision? How does taking time with patients' history actually change medical decisions? I think kind of just what I alluded to. Part of it is sometimes you can find out there's a bit of missing history that might give you a clue. I guess it's like any detective novel. Think of doctors as detectives, not like House hooked on pills, but basically we collect information, we reassess our diagnosis, we collect more information, we try something, see what happens, scientific method. I think taking the time with the history gives you the biggest bulk of knowledge. One, you can see what's already been done. You can, get a lot of facts. It's like going to a crime scene and all the evidence is already laid out. And if you're missing the weapon, that case isn't going to make it. But if all of a sudden somebody tells you, case closed. Same thing with medicine. I think taking the time lets you tease out some of the little bits. Again, simple medicine, simple problems, you may not need that much time. Cough, cold, flu, hey, my kid is sick, I got this. You probably don't need as much delving. But what if somebody's come in with a cough and it's not flu season? Oh, you had this cough for how long? What's that? You had a family member who died of some kind of lung cancer thing? Oh, okay. These clues start to add up. So I think delving into history helps you make the decision, helps you learn how to decide what to treat. Even in med school, the I think the bulk of what we learned is taking a patient history. Now I remember the days of paper, big folders that you wrote everything here: social history, family history, past history, medications, everything. Now with years of experience, you can kind of do that on the fly, but it's that bit of information that lets you really eliminate a lot of the other stuff to really focus. And again, and not miss anything. Sorry, I rambled on enough. Yeah. Well, let me see. Now, let me go. Yesterday, I talked about an article, sort of health at every size. Okay. Let me bring up my article real quick. So that one, again, was in the American Journal of Public Health. So I had a lot of questions on the private stream. Not really questions, just some comments or things. And so I guess one of the big questions was, so after this article, is health about weight or behavior? And it's a really good question. So just to recap the article, this health at every size is talking about a public health approach, so the big macro approach. Where do we try to put money into funding? What's the thing that we really should focus on to see return or results? And the one thing they talked about was, which we kind of know, it's weight loss shouldn't be about a number. It shouldn't be about the actual weight, because they're saying, look, when you try the restrictive diets, when you do all that stuff, people lose weight, but then they gain it back, or more than half gain it back. So they said, well, what if we said, look, let's have everyone shift their perception and go, let's look at the size of everybody that they're at, and how healthy are they now? How healthy are they when they lose 5%, 10%? And what does that do to their self-esteem? What if we go, you know what, Gary, you got a dad bod, okay? You're not going to be, rock star skinny, whatever it is. You may not be Arnold Schwarzenegger, without lots and lots and lots of hard work. But you know what? Losing just a little bit of weight, you'd be pretty healthy. You gain that little 5% loss, 3 kilos. Your insulin resistance coming down, your blood pressure is coming down. So I think this is where they're going, is like, let's try to make people readjust their perception. Let's not fat shame. Let's not be afraid of being a little bit overweight. We don't want to push the, model skinny, the anorexia. We don't want to get into that kind of stuff. It's saying, let's shift our perception. And if we do that, we remove some of the stigma or the bias. How often, maybe not now, but in your youth or something, when you're a bit overweight, you go to the gym and you feel a bit worried that you're doing things wrong or people are judging you, and you kind of just stop going, but don't cancel your membership. These are the kind of things that they're saying, how can we change our perception? So it was quite interesting. And again, it talks about where to put public health money, where to target the big stuff. Because again, obesity, especially morbid obesity, there are health problems, insulin resistance, gallbladder disease, coronary artery disease, the heart. You don't want a stroke, some cancers, blood pressure. So we know being obese has risks, but how much weight do we need to lose to get there, or where do we target? Let me go. And then let me go back to my notes real quick. Again, I guess basically the takeaway message is, you don't need to have elite performance body, elite performance workouts, elite performance you. What you need is just a healthier you, and you've got to find out what that is, and that can be with your doctor, with your blood tests, your cholesterol, your blood pressure, your insulin, your blood sugar, and resistance. Maybe even, your actual visceral fat and everything, just to see how you change. A good question. From a clinical perspective, how do you balance focusing on healthy behaviors while still acknowledging that body weight can matter for some medical risks? So from a clinical perspective, How do you balance focusing on healthy behaviors while still acknowledging that body weight can matter for some medical risks? Good question. I mean, I guess we go, look, we talked about some other articles and stuff about losing that 5 to 15%. So 3 to 6 kilos, scaled up, it's a range, 3 to 6 or 3 to 9, 3 to 9 kilos. I think that the idea of the healthy body size promotes health behaviors regardless of your body size. So, I guess the takeaway, we talked about yesterday was, actually getting active. Doesn't have to be elite level active, just has to be active. Be responsible with your eating. You don't have to do some super restrictive, crazy influencer diet. And I think, reevaluating, what each target that you're trying to achieve is. Right now we can go me to, Arnold. That's a big journey. And if I get, maybe let's say that's like a 3-year journey. If I get 6 months in and I'm not looking like Arnold, my chance of failing is high. Me quitting, high. And me quitting probably means I'll go into a shame spiral. I might eat, I'm going to reduce my feeling of myself and, I don't know. But how do we balance the healthy behaviors? So again, I think we just go, let's keep it realistic. Let's go, here's where I'm at. What can I reasonably be and healthily be in 6 months? And then go, okay, what would my body look like in 6 months? So now I know what healthy for this size is. And then you can kind of go, okay, well, let's not talk about the numbers. Let's talk about the biological health. So I think it's just trying to do the things that are healthy behaviors. Be active, try to eat right, and then know that like the weight should come off long term. But if it doesn't, if we're pretty stable, how do we look? Is that kind of changing? Or metabolically, how am I changing? Hey, my blood pressure's come off. Hey, my blood sugars are coming down. I think, those little tiny things with the right mindset makes it easier. I don't know if that kind of answered the question, but no, if anything, I think just changing your mind frame about where kind of the little goalposts are, the way stations, the stations are, I think will help reduce your self-stigma, that self-judgment. And then when you kind of take that away, then you can go, well, I'm not worried about that. What are the other risks I should be worried about? And that makes it easier because you can go, well, I know I can take care of these risks if I get to there or if I do this. Again, public messaging, public, a macro approach. Anyway, again, that article got quite a bit of, chat because I think, again, it talks about the obesity epidemic. And we know that food is easy and cheap and we're overweight. But, again, I think it's not looking at numbers and size. It's about looking at, do I have a good lifestyle? Am I active? Am I living kind of the life I want? Anyway, I'm just rambling on. Let's go. One of the other articles yesterday that, where is it? That got quite a bit of traction. Okay, I gotta find it. Let me come over here. Okay. Was one about. Let me come up here. The rapid weight loss. That's what it was. It was about rapid weight loss and what are the ramifications of that? And so, what one of the articles talked about, maybe I talked about it on the prior stream, but basically there was an article about maintenance of lost weight and the long-term management of obesity. So, it's just saying, we always hear about the rebound, over 50% are gaining back the weight or more. They talk about someone who lost 270 pounds and it was 270 pounds, and they lost 85, but then they gained back 60, but they were doing the exact same things. And so for this one, they were talking about, a lot of times when you're starting the weight loss journey, you lose a lot of weight at the start, and then there's a plateau. And so with that plateau, you go, well, why? Why am I plateauing? I'm doing everything I did, 6 months ago. Why isn't the weight dropping? I'm being good, doc. I'm being good. And I think what this thing was talking about was, well, I'll give you a good example. It's about, you have to look at this in the long term and from the body. So here's a good example. The guy in the example was 270 pounds, and he lost 85 pounds. So here he's doing the same thing. He's got eating so many calories per day, good calories, ones he's, not calorie in, calorie out, but calories, not too restrictive. He's doing this thing and he's lost his weight. And then he hits a plateau. Well, part of that is you go, let's call him Robert, because that's what they call him in the article. If you imagine Robert is a 100-pound person who's carrying, okay, it's probably about him, a 150-pound person who's carrying 120 pounds of extra weight. So think about yourself carrying a 120-pound backpack, or put it into kilos, whatever makes it easy. So Robert's lost this weight. So, you and me carrying a 120-pound backpack, oh gosh, we're going to be using lots and lots of energy. But we're losing weight. So now, down the track, this backpack isn't 120 pounds. The difference is, he's lost 70 pounds. This difference is now this backpack's only 40 pounds. So you go, I'm eating the same calories, I'm doing the things, but to my body, I'm not actually working as hard because I'm not carrying a 120-pound backpack. I'm carrying a 40-pound backpack. And that's sort of how they talk about weight, is they go, well, when you lose weight, you need to use less energy because you're literally carrying less weight. And so that's why people do reach plateaus, because what they're doing has to change. And that's one of the things that we do at Teletrim, is we like to keep meeting up, being with the same doctor, adapting your plans as your body adapts to what's happening to you. Not the next guy. We want an individualized plan for you, because we know that this is going to be a long-term thing. And that's sort of what goes on. And part of the thing is that Robert in the story, talks about that, it was so easy to lose initially, and then now it's hard. I'm so hungry. I'm doing whatever. Is this that adaptation I hear about? And to a degree it is. It's really your body being stronger, healthier, but literally carrying less weight. So, then it gets stressful, because now you're like, what do I do? I'm doing the same things. I'm not losing the weight. I've plateaued. It can be stressful. But then you just have to remind people that they have the willpower. It's not a willpower problem. You know how to do it. It's a biology problem. And that's where you need the doctor to tell you, okay, look, here's all the things that you can't see that you've done. Here's all the things you can't see that you're still doing now, even though the weight hasn't changed. Don't look at the number. Look at yourself. Look inside yourself, literally and metaphysically, And again, I think it's one of those things about being long-term that goes, okay, why is Robert, poor Robert stressed? He's whatever, he doesn't have a guide. And the research suggests that, chronic dieting, it can increase stress and hunger and kind of a loss of control, because again, I think sometimes those goals are too long, or people only see what's short term in front of them. You're like, I've only been at this weight. I've stayed at this weight for so long. That's okay. Your body is ramping up for part 2. Gary, you're halfway to being an Arnie. Got to change things up really hard to get you to part 2. And it raises some good concerns, because now, if he does change, from what he was doing to something else, what kind of calories does he need? What kind of macros and nutrients does he need? So it raised concerns about whether restriction-based approaches are sustainable. And so it reframes it around sort of a psychology, not your discipline. More of, hey, I know the plateau's coming, and that's okay. I will not adapt, but I will adapt my routine. I will take that on board that I know it's going to happen. I will try to avoid over consuming. I know the food. I think that's it. Good question. Here's a good question in the chat. In your experience, how can repeated dieting affect a person's relationship with food? And why does that matter for long-term weight and health outcomes? Good question. Okay. So I guess repeated dieting can affect your relationship two ways. One is some people become hyper obsessed. So this is the extreme side. That's the people who go towards the anorexia, the people who hyper calorie count everything in, everything out, to an uber obsession to where it just becomes, they ultimately kind of stop putting food in their mouth. They literally starve. Not just, hey, I'm under the calories, I need to lose weight. They literally starve themselves. So it can be a fractured relationship that way. I think the other way is that sometimes when people, they hit the plateau, or they do stop losing and they actually gain a bit, then it can go the other extreme and go, well, I'm gaining weight, I've hit the adaptation, I've given up. I'm just going to eat my ultra processed food and go about my day and at least be, miserable but happy, because my reward centers are getting filled. So that's the two extremes. I think what you see in the middle is that a lot of people get frustrated, and they kind of flounder around and just go, I know what I'm supposed to do, but it's hard, or I've been doing this and it's not working. And I think that's when you go back to your base principles. Preparing food. What are you putting into yourself? Talk to your doctor. Hey, where am I going wrong? Am I not getting enough vitamin C? What do I check? Am I anemic? Is that why? Make sure that we're okay biologically, but also work on our brains. And again, kind of going back to our health at every size, are we staying active? Are you trying to be responsible? Of course you are. You have the willpower. You got someone looking out for you. Do I need medications to get me over this hump? What do I need to help me out? So that's how their relationship can affect it. It matters for long-term weight because you do see the yo-yo dieting. You see gain, loss, gain, loss, gain, loss, loss, gain. You do see these zigzags, and part of that's just going to be kind of a natural harmonic. I mean, Christmas was kind to me, but it was not kind to my waistline. So now I'm working responsibly and slowly to bring that weight down. So I think it matters for long term because there's going to be hard spots. Maybe it's huge Easter celebrations. Maybe it's Christmas. Something, birthdays. Everyone's birthday is in 1 month. So, this birthday cake every weekend, delicious birthday cake. So delicious. So I think it matters for long-term weight and health outcomes because, you can see a little bit of wiggle room. Okay. It's okay. We're in a zone, and as long as we're within that zone, that's okay. And then in the long term, we go, okay, well, let's just try to bring the zone down a little. It's okay. You're fluctuating. We're still in the zone we want to be in, and then bring it down. And I think over a long term, that's a much better trend and trajectory than, I'm going to lose 9 kilos, I'm going to gain 8 kilos. I'm going to lose 9 kilos, I'm going to gain 10 kilos. These big swings. And we know those big swings are much more stressful on the body than little swings. Okay? Again, think 5 to 10%, 5 to 15% loss, huge health benefit. 5 to 15% gain, we're going to take a step back. But, if we stay in between the bounds, we're going to be 2 steps forward. Okay? I guess one of the things that that comes up often, really often. Hold on, let me get my little questions up. One of the things that comes up really often is why are lifestyle factors like sleep, stress, mental health often overlooked? And I think it's because those things take time. Sleep is really complicated. I tell everyone sleep's a two-phase problem. Sorry, it's a two-phase problem. The first phase is getting to sleep. The second phase is staying asleep. So the first phase is initiating sleep. And that takes a lot of sedation because our primitive monkey brain is looking for lions. It's looking for threats. And you got to shut down that risk assessment, that threat. That's a scary time. So that takes a lot of sedation. But when your body's actually asleep, it's kind of giving up. Whatever, lions eat me, I got to recharge. So when you're asleep, you need a lot less sedation. You just need someone to be, your body just needs, it's okay, pat, pat, pat. It's okay, pat, pat, pat. And do that the whole night. So I think there can be a lot of factors that can disrupt both sides. A lot of it is a bunch of us are overworked. Job stresses, financial stresses, family stresses, kids, kids and money, everything. And those are complex things that keep you up. So I think the lifestyle factors, they weigh, and they're difficult to untangle. There may not be a perfect solution for it. It may be trying a bunch of things. It may be meditation, or maybe trying to actually clear out some of these life stresses, which may cause more stress initially. So I think it's overlooked because they're quite difficult. And I think the signs, or what signs tell you that lifestyle is playing a bigger role than patients realize, is that the signs are that, we do see the struggle to lose weight is harder. We do see biologically and metabolically, we do see higher blood pressure. We do see, more fat deposition from that stress hormone cortisol. It comes up, that big baddie, adding fat to our visceral fat, organ fat. So, all of these things are playing in, and we know, organ fat leads to insulin resistance, which leads to more fat gain, visceral fat gain, more fat gain. We get stuck in that cycle. So I think lifestyle is, again, it's one of the harder things to tackle, but can help, especially in the long term. Here we go. Here's a good question. In terms of weight loss sort of guidelines, and so, how do you use guidelines without losing sight of a patient's individual circumstances? And it's both easy and hard. So I think the easy way is that, one, when you get that personal connection, you learn not necessarily what your patient's limits are, but you learn, how far are they able to push themselves around life stresses, time commitments, work commitments, and just you learn what's comfortable, and not necessarily comfortable as in it's easy, I'm just gonna lay on the couch, but more about how much can you push someone before they decide this is too much, I'm gonna quit. So I think you get to learn people about that. And then I think the other thing is that you can use the guidelines and go, well, this is what we need to do. Where does my patient fit? Look, they're a little bit over the guideline here. It's okay. Maybe we can flex a little bit over here, and try to keep them within that zone. Again, little swings, not, we're not going for some extreme influencer diet or anything like that. I think it's go. I guess, again, I talked about the weight loss, rapid weight loss yesterday. And I think one of the things was for rapid weight loss, what are signs that tell you weight loss is becoming unsafe rather than helpful? And I guess the big thing is you can look at the clinical signs and also the metabolic signs. Again, we talked about there's specific diets and stuff, but you look, are there nutritional deficiencies? Are my gums bleeding? Are my teeth falling out? I have scurvy. I'm a pirate. Some vitamin C. Your diet's cutting out something. It's that vitamin C. Don't have the juice. It's too much. No, don't have the juice. It is definitely too much calories, but have the orange. Other things we see are, people, vegans, not to pick on them, but they eat less meat, so they don't get B12, something we get from, animals. They have generally less iron, so they tend to be on the anemic side. We see other diets like low carb or Atkins where, that extreme restriction of carbs leads to a loss of other nutrients, thiamine or some other things. And overall restrictions may be leading to kidney stones, or some of the restrictions for other diets, we might see gallbladder problems. So I think rapid weight loss is something to look out for. Now, let's take a break from talking about all these articles. Again, tomorrow, I know I promised you today the RACGP talk or article about how much misinformation is out there about weight loss and what's being done. So I'll talk about that tomorrow at my special Makeup for Tuesday live stream. But it is Friday, and one of my favorite segments is Food Swap Friday. I don't know if I really have any good fails, but I think last week I talked about, my food swap last week was for coffee. You could substitute evaporated milk for your full milk and save a lot of calories. And get the same or even better satisfaction from your drink because you get more milk fats, which gives you better mouthfeel and better sort of fullness. So, check out last week's Friday Food Swap. It's a pretty good one. I think today I was going to stick with coffee because this is one I noticed when I accidentally drank someone else's coffee. They hadn't drunk from it yet. We grabbed the wrong cups. I love, having a vanilla coffee is really good, especially when I make my own at home. Sometimes you just want to add that little bit extra. And it got me thinking, and when I'm at home, what I do is I use a little bit of vanilla extract in the cap, just dump it in my coffee, stir it in with my evaporated milk, so it's nice and good, and it tastes great. But when we were out at a coffee shop, they used the syrup, and it got me thinking, like, whoa, okay, this coffee is really sweet. It is vanilla-y, delicious, but very sweet. So it got me looking, what is in these syrups? So in those syrups is a lot of sugar, okay? Like 20, 30 grams of sugar. And so it got me looking again at numbers, and it turns out that if you're a big coffee person, maybe you have 2 coffees a day, you might be drinking 200 extra calories a day. And that's not even eating a single bite, It's not the coffee that's the problem, it's what's going in the coffee. Some coffees have more calories than breakfast, and we drink all of that before 9 a.m. Okay, so today I'm going to talk about coffee extras, the tiny things that add up. Okay, so vanilla syrup. Let's start with that one because that's what actually got me rolling on this one. 2 pumps of vanilla syrup at Starbucks is about 80 calories. Okay, and a lot of people have more than that if they have more than 1 coffee a day, or if they're after extra vanilla. Okay, so think 2 pumps, 80 calories. A little capful of real vanilla extract, 10 calories. Okay, so you get the same aromas, the same flavor, but you saved 70 calories or more in 1 coffee. Okay, amplify that for coffees. And you're like, oh, well, 70 calories, that's not that much. But do the quick math, okay? 70 calories, 5 coffees a day, 350. 10 weeks, that's half a kilo, that's a whole pound. 20 weeks, a whole kilo. 40 weeks, another kilo. That's 2.5 kilos, a little over 5, almost 5.5 pounds, just that you could save for making a substitution. So a quick check. Who out there adds syrup to their coffees? And Lisa, I know you do, because I stole your coffee. Another one, so this one's a little bit, I wouldn't call it controversial. This one's a little bit more confusing for the mind because it shouldn't work, or conceptually you don't think it'd work, but surprisingly, it's not too bad. So for all my cappuccino fans out there, you know what you get. You get your coffee and you get that little sprinkle of chocolate on the top. That chocolate is not free of calories, okay? That chocolate dust is about 20 to 30 calories, okay? So it's not huge, but again, that adds up. I mean, if you get a vanilla thing and that, you're looking at 100 calories. So again, 30 calories, 20, 30 calories, that adds up. 1 week, 100. 52 weeks, that's almost just a kilo, almost 2 pounds, so 1.75 pounds, give or take. So what you can swap for is you can actually swap for a little bit of cinnamon. And I know people are like, this is going to be gross. This is going to be, isn't that challenge they did where people took a spoonful and nearly died on it or something? Yeah, not that much cinnamon. No. Just a light sprinkle of cinnamon. Again, it's just cinnamon itself is a little dried tree bark that's been ground up. It has almost no calories, next to none. But what it does is it gives that warm, kind of sweet cafe flavor texture that you get from the cocoa. And, that's saving calories. So everyone out there, be honest. Chocolate dust or cinnamon? Which team are you on? One more little chocolate topping substitute you could do, I've heard, I haven't tried it personally, is a little bit of ground nutmeg. Nutmeg stores well. Nutmeg adds like an earthy flavor to dishes. And again, when you grind it up, it's a powder, so it kind of gives you that right mouthfeel. But again, it gives you that earthy flavor of like a darker styled chocolate or something. So one I haven't tried, I've heard about. I'll try it this weekend and report back. Could be a food swap fail. We'll find out. So again, I guess what's the takeaway from this food swap is that, these are all sort of liquid calories because we're drinking and doing whatever. And liquids don't fill you up the same way that solid food does, because it passes so quickly. So the stomach doesn't get stretched. It doesn't send that "I'm full" to the brain. So you got to think about it. One of the reasons this liquid thing is important, because you do get a lot of people who they're either fasting or doing something. I only drink liquids in the morning. I'm not eating that much. There's calories. I barely eat anything, doc. But they're drinking 2 or 3 coffees a day that have all the extra milk, all the extras, that syrup. So they kind of hitting like 200-300 calories a day without noticing. It's like a McDonald's cheeseburger or something. I don't know. How many coffees are you having right now? So again, if you save 100 calories per coffee and you do that twice a day, that's 14 calories in a 7-day week, not just weekdays if you're at work. That's a lot from just one tiny habit. So, yeah, I think Teletrim approved food swap, definitely. It doesn't mean it's perfect, but it means it's repeatable and it's going to save you. Okay. I guess question for you guys out there to hit me up with is, what's one thing you could swap in your coffee that you could start tomorrow? Let me know. I'm always looking for a good swap. So, okay. And the takeaway is, don't give up on your coffee. If you like it, don't give up on your coffee. Just don't drink your calories. You want to waste calories on drinking something, or do you want to save those calories for a dessert or a main or something? Okay. All right. We'll tune in tomorrow. We'll pop up the times for when I'll be on tomorrow, or if not, catch the video, the replay. Enjoy your weekend.